The President said last night, and I mentioned it a few minutes ago, that if anybody in this body told an untruth about his proposals on health care, he was going to call them out. Well, as I said before, that's a double-edged sword, because I think the President made a number of misstatements last night that need to be corrected, and the American people need to know what they were. As a matter of fact, one of the things he needs to do is he needs to take on the Associated Press, because they have a news article out today that says Obama uses iffy math on deficit pledge, and they point out that his arithmetic isn't quite accurate. But let me go into some of the specifics. He said last night, nothing in this plan will require you or your employer to change the coverage or the doctor you have. Let me repeat this. Nothing in our plan requires you to change what you have. The majority leader just a few minutes ago said we really need to keep the public option in, and that's what they would like to bring to the floor. Well, let's say they do that. If you're an employer and it costs more than 8% to take care of your employees and health insurance, you can dump them on the government plan for 8%. So if you're spending 10% to pay for your employees' health insurance and you want to cut your costs, all you have to do is put them on the government plan and pay 8%. And so there is an inducement for people to go on the government plan, especially the employers transferring them. And as a matter of fact, independent experts all agree that the legislation proposed would result in millions of Americans losing the coverage they have. The Congressional Budget Office, this body right here's Budget Office, believes several million will lose their coverage. The Urban Institute says it'll be up to 47 million, and the Lewin Group says it'll be up to 114 million. So I would say, Mr. President, that's not quite accurate. He also said, quote, under my plan, individuals will be required to carry basic health insurance, just as most states require you to carry auto insurance. That is going to be what they call a government mandate. And one of his senior Obama administration officials, Sherry Glide, recently wrote that a mandate is, in many respects, analogous to a tax, and furthermore has the potential to be a very regressive tax, penalizing uninsured people who genuinely cannot afford to buy coverage. Thus, this policy stance breaks the signal promise of the Obama campaign when he said, I can make a firm pledge. Under my plan, no family making less than $250,000 a year will see any form of tax increase, not your income tax, not your payroll tax, not your capital gains tax, not any of your taxes. Not accurate. Quote, the President said, there are those who claim that our reform effort will insure illegal aliens or immigrants. This true is false. The reforms I'm proposing would not apply to those who are here illegally. Look at H.R. 3200, their bill. It says, nothing in any of the Democrat bills would require individuals to verify their citizenship or identity prior to receiving taxpayer-subsidized benefits, making the President's promise one that the legislation itself does not keep. So that wasn't accurate, Mr. President. And here's another quote. And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions, and federal conscience laws will remain in place. Fact. The National Right to Life Committee, among other independent pro-life groups, have confirmed that the legislation will result in federal funds being used to pay for abortions, both through the government-run health plan and through federal subsidies provided through the exchange, despite various accounting gimmicks created in an Energy and Commerce Committee, quote, compromise plan. Much of the rest would be paid for with revenues from the very same drug and insurance companies that stand to benefit from tens of millions of new customers. Fact. Oh, let me see. I just missed my place there. I don't want to do that. The President said reducing the waste and inefficiency in the Medicare and Medicaid will pay for most of this plan. Much of the rest would be paid for with revenues from the very same drug and insurance companies that stand to benefit from tens of millions of new customers. Fact, the Congressional Budget Office, our body, has previously found that the cuts to Medicare Advantage plans included in the Democrat legislation would result in millions of seniors losing their current plan, a direct contradiction of the President's assertion that nothing in this plan requires you to change what you have. So that's not quite true. It's not true at all. Quote, the President last night, this reform will charge insurance companies a fee for their most expensive policies, which will encourage them to provide greater value for the money, an idea which has the support of Democrat and Republican experts. And according to these same experts, this modest change could help hold down the cost of health care for all of us in the long run. In fact, while some Republicans support addressing the current employee exclusion for health insurance in the context of overall tax reform, the President's proposal would raise fees in order to finance new federal spending, a tax increase of hundreds of billions of dollars, and one that most of us on the Republican side would never support. Finally, the quote.
The gentleman's time's expired.
There's so many of them, folks, I can't get through them all. But, Mr. Speaker, I'd like to submit this for the record, and I'll be back.
There's no objection. Ms. Lowe of New York.